Well, good afternoon. It is Friday, December 31st, and most of us know it as New Year's Eve. This is the 94th week of the Flint Community Webinar on Coronavirus, and we are so excited that you've joined us, those of you that have taken just a few minutes out of your busy day today to join us, whether you're joining us by actually being in the webinar or you're joining us looking at it on YouTube or Facebook. We want to welcome you today to this 94th session of the webinar. The webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. And this team is so delighted to be able to share with you every week. I'm thankful that I've been able to participate as a moderator for most of these 94 weeks, but we've had some other great moderators as well, and we want to thank them for their time and effort in helping us to deliver this webinar. Today, we are also thankful for, after all of these weeks, our wonderful array of partners who continue to provide information for us today. Many are off on holiday, but we want them to know that we appreciate their input because some have even provided input, even though they're not able to join us physically today. We want to take a moment to just say thank you for everybody, those of you that have joined us as participants. This webinar would not have been as successful as it was and is without your input. And today we've got something special. So for those of you that have joined us, we're going to have, I'm going to tell you this early, we're going to have an open mic session. So if you are one of our participants and you want to share with us today, we want you to know that you just put your hand up and we'll be able to acknowledge you and then give you an opportunity to share in the webinar today. Want to get that in early because I'll get started with this wonderful panel that we're going to have here shortly, and I might miss that. So today's topics. Today we're going to follow up. We have now been 24 months COVID. December 2019 is when this virus emerged and we began to learn about it. It was a few months later when we started the webinar, but it's been 24 months of COVID, and we want to talk about some lessons learned. We also want to hear from you. As I mentioned just a moment ago, your voice matters. It has been tremendous, a tremendous support for us to know how to respond to the questions that you may have had during the year and what may be coming forward. That's why we're going to be looking ahead to 2022. The one thing we know as a result of what we've seen in the last few weeks, there is more in 2022, but we do want to put forth a great effort to reduce some of the complications, the infections that we're seeing through COVID. And that's why we're here talking to you today. Our wonderful panelists, Dr. Susan Wolford, Dr. Jennifer Edwards Johnson, Dr. Lawrence Reynolds, Dr. Deborah Verholden, and Dr. Pamela Hackard are going to be here to talk to you today and give us some more insights about what's going on around Corona, Delta variant, Omicron. How do we keep ourselves safe? So again, join us in this conversation today. You can always give us a call at 810-835-2130, and we'll be happy to try to get your questions in as well. So let me welcome our panel today. Dr. Reynolds, there's Dr. Reynolds, Dr. Wolford, and Dr. Jennifer Edwards Johnson. We're looking for Dr. Deborah Verholden and Dr. Hackard. They're going to be joining us shortly. Let's just get started. We were having a little bit of a conversation, just starting right off talking about the babies, because the babies are so very, very important to our future, and they can't always take care of themselves. And so one of the questions is, and we're going to start off this with you, Dr. Wolford, as we were sharing earlier, there are some babies that still cannot get the vaccine. And we are hearing more and more that these younger children are being infected with the virus. So help us start off right off. What do we do to protect our babies?
Well, thank you so much, Yvonne, for raising that question, because I feel like in this discussion of COVID over the last 2 years, a lot of it, quite rightly, has focused on adults, but children have been very central to this, the pandemic, and to what we need to do to keep our population safe the whole time. So I'm going to start with the vaccine. Okay, those who can get vaccinated should get vaccinated. The ones from 12 to 16 have been able to be vaccinated for a long while, and more recently, the 5 to 11-year-olds. And there were those who were sort of waiting to see if the vaccine would be safe or not. They wanted more people to get it, and now more people have. We have a lot of, I think, over 8 million 5 to 11-year-olds have received the vaccine. And what we know is that there are very few, smaller than any other age group, with any problems that happen with this vaccine. So we know it's safe. And so if you have a 5 to 11-year-old, you should in fact speak to your doctor and go out there and get them protected, give them that gift. But then when we think about those who are younger than 5, those who cannot get vaccinated, this is a really crucial moment, because as we have seen, the variants cause different problems, right? And so we've heard with this Omicron variant that maybe it's less severe for adults. But what we have also heard is that it appears to affect more children. So we're having more children hospitalized and more children getting quite ill because of, we believe, this new variant. So it's even more important to protect those little ones. And I think we were saying earlier that Dr. Reynolds has some great input on how to put all those layers in place to protect them. I will just say that one of the things that parents can do is that they themselves get vaccinated, and also they create this protective bubble around those young children who can't actually get the vaccine. And then I'm going to hand over to our other pediatrician for him to give us some more of those layers.
Dr. Reynolds, these are lessons that we've learned in the last 24 months. You're still on mute, Dr. Reynolds.
How about now?
Now we got you.
Okay, I promised Dr. Edwards Johnson I'm gonna stay in my lane too. But I'll say it this way. I had to tell a neighbor friend, you just became a grandfather last week. You have to act like a grandfather now. And that means get your influenza vaccine, as well as make sure you have your COVID-19 vaccine, because they are infectious. They spread, especially in this time of year. And we just don't want to put our loved ones at risk. And that also includes those who are immunosuppressed and other things. So I repeat my message, it's not just about us. And yes, vaccination is the foundation for the prevention of infection. I didn't say it eliminates infection 100%, but it improves our chances. And everybody's talking about this Omicron variant, and that's good that we are aware that there are mutations. Those mutations are caused by some of it is caused by our inaction. Those of us who did not get vaccinated, who allowed ourselves to become infected, and the virus says, oh, this is a great place, let me mutate. And so then we get a variant. So still, vaccination is the foundation for prevention of infection. It will reduce it. Nothing will 100% eliminate it. But when they say Omicron is less severe, as my colleague has said, well, it spreads more, which means there's more chances of more people having problems, especially if they're not vaccinated and boosted. So here we come back to vaccination is the first layer of protection. And we go to the Swiss cheese model. And one is wearing a mask. Okay, and we discussed the different kinds of masks, and later on we'll talk about what doesn't work, but that's one layer of protection. Physical distancing. Okay, and I forgot the main one is think before you act. If you walk into a setting that it's crowded, poorly ventilated, people aren't wearing masks, and the folks aren't vaccinated, perhaps that's not the place for you to go or take your family. So, I'll share a story with you. We had a house guest, flew in from out of town. I thought the person knew all my rules. The person came in with a mask on. Then I find out 36 hours later, the person has never been vaccinated. And despite my rules and warnings, and within 36 hours, that person was positive for COVID.
Mm.
So thank goodness she kept her mask on. Thank goodness we kept our physical distancing. And thank goodness we will get tested in 5 days. And see, this is what happens when you don't think about others. And I'm on a rant today, so if you'll pardon me, I've heard a young person tell me, well, the doctors and nurses and hospital staff knew what they were getting into when they joined that profession, and they shouldn't complain. And that my decision about getting vaccinated is private. You see, but it's that once again, not thinking about your neighbor, your loved ones, or your families, or your coworkers, or even your enemies. You are just setting yourself up for a situation where you can spread illness or take up space in a hospital where there's someone else who needs critical or important care that has been delayed because there's insufficient staffing to cover the beds in the hospital. Now I'm done ranting, so you can ask me.
Well, Dr. Jennifer Johnson, I heard you. I mean, I could just feel you take this gasp about the comment that you knew what you were getting into in this profession. Who knew about this virus? Can you?
I want to, we assume a certain amount of risk, right? There's a certain amount of inherent risk that we know occurs with our job, and I think the majority of us are happy to take that on and are certainly aware of it. I think there's some quid pro quo there. I think we expect that we work together to keep each other safe, that our patients and the people that we work with will all work together to keep each other safe. And that means masking, getting vaccinated, decreasing the potential of infecting someone else. But I think Dr. Reynolds makes a really good point. You think that the workforce got into this and has to do this work. And we're seeing that the workforce does not, because the workforce is leaving, right? We've seen a significant decrease of nurses, physicians, people who are burnt out and tired, and frankly, did not sign up for the risk that includes people not taking care of each other, right? And I think that's the big concern is if everyone's doing their best, we certainly did sign up to treat and take care of people who are sick in their time of need. I think we just ask that you do the same by doing your part and doing what you can do, which is wearing a mask, avoiding the hospital if you don't need to be there, right? Doing your very best. That's kind of my doctor hat, but my parent hat is I've been doing all the things that Dr. Reynolds and Dr. Wolford, who I get to learn from, recommend so that I keep my kids safe. I have a 6-year-old who was just able to get vaccinated and a 3-year-old who isn't able to get vaccinated. And I'm in the hospital, I'm seeing patients. I have my N95 wherever I go. I have not been to a social outing in about 2 years. I was joking with my partner, my husband, that like I haven't been to the hair salon in a year. I've been doing everything at home because I've been trying to keep my family safe, right? I am not doing anything that I don't absolutely have to do. And the thing I still love to do is to take care of patients. And I just hope that patients and families are willing to stick in there with us and help protect us and themselves.
So doctors, you make a great point that we as members in communities, we rely on our physicians and the medical professionals to help us. But you're saying we need to be in the mindset that we need to help you as well.
And I think helping us is helping yourself, right? What Dr. Reynolds is talking about is a workforce that has significantly left in lots of places. We've seen nurses quit, we've seen physicians quit, we've seen patient care techs quit, right? There's a mass exodus of healthcare providers. And that understaffs hospitals across the state and across the country. That means there's more wait times in hospitals. That means, the more people who are sick, the more people who are infected, the more people who have to go to a hospital that's already understaffed, right? That builds up in terms of increasing morbidity, longer wait times, longer illness, more severe illness, and people who just can't be seen because there's not a workforce to care for them.
Mhm. I mean, I think that physicians and healthcare providers are people too, and are trying to get through this pandemic like everybody else, but with an additional burden on top of it. I mean, it's not that there are others who have high burdens as well, right? Those on the front line in the grocery store. There, I mean, there's so many people. This pandemic has shown that it is testing us in every possible way, and mental health and stress are one of those things. And we're going to see that we've seen that that has impacted children, much more stress, much more depression, many more concerns, anxiety in kids than we ever saw before. But we're seeing it in all the different areas as well. And it certainly doesn't help if you in the healthcare profession are doing your best dealing with the stress of the pandemic, plus the stress of being understaffed and being called to do things that one possibly did not have to do before. And then on the top of it, somebody says, well, you signed up for that anyway, so, whatever. It's just, that isn't really terribly helpful, and people are not going to stay. And as Dr. EJ has said, they are not staying. I think it's really important for us to remember that we are our brother's keeper. Everybody has to realize that you are your brother's keeper. And that's why you wear your mask. That's why you're considerate about what other people are doing. And that's why we pay attention to the mental health needs, to whatever those needs are, that wherever we can be of assistance, we should be. And because, as people have said so many times, we are all in this together. No man is an island, and we all need to support each other.
So as we talk about the medical profession, and thank you for that, we also have to understand our public health professionals as well. And I see Dr. Pamela Hackert has joined us. She is the director of the Genesee County Health Department. And I know she's got some things that she'd like to share with us about working together as a team. Dr. Hackert.
Well, I'm afraid I joined late because of all the craziness going on right now in the state about these different issues about when did the CDC make those recommendations based on a false number, the 73% Omicron, when in actuality at the time it was still only about 23%. So those were coming out, and they came out the same day they corrected it, which should have only been 59% as opposed to the 73% reported, and the vast amount of differences between that. And so in the last 3 days, and I understand, the state of Michigan's doing the best it can as well, but it's been whiplash. A new guideline is coming out every 24 hours this week on what to do with it. And there has been so much frustration about that. And some place I had said I was originally not going to be following it, and then they changed it that they were going to reconsider it, but then so many other places had already changed it. And so I am finding that same frustration about responsibility of communities. And I will indulge myself in also giving a bit of a rant because it is so incredibly frustrating and disheartening and almost incapacitating at times to see the response of some of the members of the public even saying that it was the health department who made masks optional. It's like, no, we never ever made masks optional. And the giving my very, very highest, strongest recommendations, I always am seen with a mask on now. And my children attend place like the football games. They are one of 5 people, I swear, out of 100,000 who are wearing masks. I live and breathe with a mask on, and it is just whether or not it's appropriate given different circumstances as to whether or not it should be at this time the health department doing a mask mandate, or should the locally elected school boards have that decision. And the only correct decision to make at this point, truly the only correct decision, is particularly with variants, is everyone should be wearing a mask in schools. They should be wearing a mask at any time that there's an event where they're not actively engaged in outside physical participation of sports. And so I'm just incredibly frustrated by this situation that somehow, when it was the county saying there are now vaccines available, and take this argument that you have against masks to your locally elected school board, that was no means a decision or a recommendation to make masks optional. They should not be optional. And I will say that over and over again, even in my sleep, I say masks are not optional. They should be done. And it's just as though the state of Michigan is doing the same thing. They are saying the strongest recommendations is to wear masks at all times when you are out in public now. I wear them in crowded outside settings, which is not even still, one of the guidelines, but I think that only makes sense with Omicron. But it's very frustrating to me. And so please, please, please wear masks. If you want your children to be wearing masks, petition your local school board. They're the ones who can control that, and get vaccinated. It's just absolutely incredible how much difference there is between someone getting a breakthrough case who's been fully vaccinated and boosted, where they have these slighter symptoms, and the potential for, even with Omicron, which is considered milder, but it's not really necessarily milder for those who are not vaccinated. But just also to touch about the comment about, well, this is what people signed up for. It's like, no, indeed, it's not what people did sign up for. And even myself, going from clinical medicine 1 year ago on January 5th to coming back to public health. I mean, I left public health to go do a new fellowship and do clinical medicine, came back because I felt like I was needed to do that. But really, I want to go back to clinical medicine and practice that. But someone needs to be able to help with this fine line that everyone is walking right now. And so I find it really frustrating. And if people, it's a topic that's rarely talked about among physicians and rarely talked about with the general public, but physician suicide rate is twice as high as the general population. And now with COVID, it's gotten even higher. And with COVID requiring the hours that people are working and the masks that we work behind all the time, it's harder for others in the profession, in nursing or in medicine, to be able to identify those people who are at risk for suicide, those physicians, those nurses who are at risk. And sadly, like, the actual #1 way of committing suicide for physicians is a gun, which I don't know how much people know about the use of guns for suicide, but it is one of the ones that people use when they have a desire to not allow themselves a way to back out.
Mm.
And so those are all, like, that's where I'm at right now. And Happy New Year. It's really a tough time right now.
Yeah, one of the things you point out, Dr. Hackert, is one of the lessons, the many lessons that we've learned, is the more we learned, the more things change and the more there is to learn. This is the first time, we've heard a lot about mental health issues and suicide issues in the community, but not really knowing the impact that this has had on physicians. And I can remember even back, we talked about Ebola and all of the challenges that people face. We talked about HIV and AIDS, but this is it feels like uniquely different. And I don't know, from a physician perspective, Dr. Edwards Johnson, is there something you all of you have been in hospital settings and working? What's so uniquely different? Now I got an idea. Let me just say, I think it's so political, and maybe I'm wrong, but it's just something about this COVID that has just changed the dynamic of how we interact, even patients, physicians, and community.
I think there are a few things. I think the way we access information is different, right? You alluded to it, that it's been politicized. There used to be much more of an emphasis on creating a relationship with your physician to arrive at a decision regarding your health, right? And we are fortunate enough to have information immediately at our fingertips. A lot of times we're not necessarily equipped to wade through all of that information, and we don't know what to do with it. We're not sure how to source it, what source is reliable, what we do with the information we have. And a lot of what I see is that as physicians and healthcare providers, we are sort of battling against multiple sources of disinformation, right? That might not have been available and certainly weren't as accessible maybe during Ebola pandemics, et cetera. And layer in there the politicized nature that you kind of alluded to, right? And so instead of a context where patients are normally having conversations with their physicians and are trusting us when we say, I have spent, 2 hours every evening reading all the data on these studies. I feel really good about the vaccines, and I trust I've gotten them myself, and I'm getting my kids vaccinated. We will say all of that in a patient visit, and I'm seeing this in person. And I'm going to do my own research. And I think it's important to do your own research, but I think you have to back that research up with trusted, credible sources who can help you reach through all of that research and search through all of that data and help you make decisions that are specific and make sense for your health. So I think that's one piece. I think, and everything seems really bad when you're in it. I was joking with someone that a lot of times in places I'm like doing the Cupid shuffle, right? Like I'm like, okay, like I'm trying to keep my distance from people, and that sense of anxiety is always with me, right? Because I said I'm a parent and a healthcare provider, right? I'm always, trying to minimize my risk and thinking about, what happens. I'm vaccinated, but I've got a kid who isn't, right? And how do I mitigate that risk? So that anxiety is always with us, and we're living that currently. So I think there are those two things where it's a different time. People are getting information from different sources and multiple sources, and not necessarily their healthcare providers. And we're actively in it. We're actively trying to navigate it for ourselves and our families and our patients.
I think it's so true that change, that the fact that we're actively trying to navigate it. So things are changing, right, over time. And so I think that impacts the communication. And I feel like we're sort of losing the battle a little bit, because those who are dealing with the science, we will say something to the effect that most people do well, very few have problems. And it's a nuanced message, and it changes one week to the next. Well, not maybe, but it changes rapidly as we learn new things, right? Those who are engaged in misinformation will not be nuanced in their communication. They're like, do this and you're gonna, kill your child. And that sticks in people's minds. And this is happening on top of a history of injustices within the healthcare system. So people are not sort of completely loopy to think that there could be problems, right? And maybe they're not being told the truth. So with all of those issues, I feel that we really are losing the battle in the communication, and we have to think differently about how we do that. So giving the science is one thing, and I'm all about giving the science. I think that's really important, and we should share that. But Dr. EJ mentioned a really important thing, which is trusted sources. We have to try to connect. If you are somebody who knows the science and have gotten your vaccine and understand this situation, communicate with those in your sphere of influence. They are more likely to believe you than they are to believe some stranger telling them the science. So I think we have to reach out. We have to be somewhat sort of evangelical in this. We have to go out there. If we have friends, family, people who trust us, share that with them. But also we have to be very nuanced in how we we can't push people. If you try to force them to do it, the likelihood is they're not going to want to change. And so using different approaches, like there's a motivational interviewing way where you listen to their side, really listen, even when they're saying egregious things that you know are not true. Listen to their side, hear their fear, hear what they're really feeling. And then if they allow you, try to interject something that might be meaningful to them because they trust you.
I think you make a great point, Dr. Wolford. The communication has just been so incredibly challenging. And when you have one side that is very emphatic and the other side is trying to reason it out, it's not always that easy. And yet we see the results of the poor communication. It's killing our communities in many, many ways, economically, socially. And so I'm so thankful we're hearing the physician perspective this morning. It wasn't quite the direction, but this is absolutely important because it is helpful for us to hear the other side of the story. We're going to have to really work harder on this. How do we better communicate? Dr. Reynolds, I know you want to jump in here.
Yes, and I was impressed this week when I heard a physician commentator on the news say, this virus makes us humble. And in that it's a new virus in human beings. We have little experience with it. We have tried and tested tools that are effective, but it seems like every 1 or 2 weeks we learn something new. And mutations throws a whole new wrench in that. However, we have to admit our tools are limited. When we talk about response to vaccine, right now we're looking mainly at antibody levels. That's not the whole story. You've heard us talk about before, there's also cellular immunity. Your body makes cells, and they're called killer cells, that actually will destroy an infected cell. But we have no way of measuring that in a broad population because it's a very elegant study that takes time. And we are in the midst of a pandemic. And then there are the helper cells that help the other cells make more antibodies. So we are trying to use tools that give us an indication of how things are going, but it's not the whole story. And then, as Americans, we have this tendency, we want instant answers. It's like you put some coins in a vending machine, press a button, and out pops your answer. So we say, well, how come you don't know about the variants? Well, it may take a week or two to do that special test called genotyping to identify a mutant. Then it takes some time to hook that information up with the clinical manifestations to understand that it really is significant or it is not significant. Then we have to look at how it affects the effectiveness of vaccines. So, folks want an instant answer. It's on the news tonight, and tomorrow we want an answer. And if we were to conduct ourselves in that fashion, that would be dishonest. We need the information in order to give an answer, which is why the state of Michigan said, we want more information from the CDC before we change our recommendation on isolation and quarantine. And that's the prudent course in the midst of a pandemic when people's lives are at stake, resources are at stake. And so, it humbles all of us. So let's just keep that in mind.
It's
So,
interesting.
go ahead, Dr.
It's interesting that you say that, right? We get information daily. And I remember Dr. Wolford talking about the Omicron variant and how many deletions there were on the spike protein. And I don't know if everyone realizes, like, that's 2 hours of sifting through data and reading papers and knowing exactly how many mutations there were and understanding. And that has been in addition to whatever patient care you do, right? Like in addition to whatever other responsibilities, you think about what we do as physicians on the front line who are caring for patients, but then there's the back end of all the work of learning this in real time, right? I was going through how many books I read this year and I was like, oh, I'm a little behind. Oh, because you've read like 3 books of COVID data, right? Like there are every day it's like, okay, let me see what's new. Okay, I see that in the news. Let me talk to my trusted experts who are in virology, who are pediatricians. It's phone calls, it's new papers, it's papers that haven't even gone to press. It's trying to understand new therapies so I can be on it and prescribing it for my patients, right? There's all of that in addition to what we've already described.
That is hours.
Go ahead, Dr. Wolford.
That's hours, and I have to just resonate. It is hours and hours of work. And that's why it worries me a little bit. I'm not worried when somebody says they're going to do research. I want people to study this, but sometimes there's some missing information when people just go and read on the internet. So I try to listen to other sides of things and to people that maybe I don't agree with wholeheartedly, just to see what's out there. And so for example, I was listening to somebody who was saying, look, in one of the best journals, Circulation, it's a really good heart journal. This is real science. Here's somebody saying that the vaccine may have problems, causing problems with the heart in a bigger way than we thought. I thought, really? Is that true? Could that really be true? So I went and had access to Circulation, found the article. I'm like, oh, it is in Circulation. Let me read it. So then I read it and I thought, really? This cannot be so. As you go further and research further, then you realize it was an abstract from a conference, which they just published all of the poster abstracts from the conference. And in fact, there were they retracted many comments afterwards about the errors in this. None of that got said. And anybody who was doing sort of the basic sort of search would have said, oh my goodness, can't get this vaccine. But when you search it out, you realize, no, this is not something that should stop you from getting the vaccine. But how many people really would know that in their own research, or their own studying or searching of the internet, which is why I think that as physicians and healthcare providers, we have to do all of that searching to be able to provide this extra information, and which is why I think it's important for people to connect with those who may have access to some more information than they're getting just in a general cursory search.
So I think that's your point, Dr. Wolford and Dr. EJ, all of your points is this whole issue about what we're experiencing now with COVID is a research in process. It's in progress. There's so many studies going on, and some of them are using such small sample sizes that it really can't be generalized to the larger population. But if you're not a good consumer, if you don't have that background, that would be something that you wouldn't know. So I appreciate this webinar, having the opportunity to tease out some of that and at least encourage people, if you're gonna do your own research, dig a little bit deeper and then come and ask some questions. So just right now, we're gonna take a quick shift because we committed that we would hear from some of our participants today. And I want to first go to Tanya Battle. She put a comment in. And Tanya, we're going to unmute your mic so that you can just come on and share with us, because you made a wonderful statement based upon a comment that was made by one of the physicians earlier. So we're going to ask you, Tanya, to come on and share that point of view.
Hi, good afternoon, everybody. Can you hear me?
Yes, we can.
I just agree. When Dr. Reynolds made that statement that somebody said, they or whoever made it, you knew what you were getting into when you just signing up to be a nurse or be in healthcare, period. Well, that is our, service to our community, but we certainly, there's a responsibility for our community as well to take care of themselves. So, that we're all working together. So I just, again, applaud Dr. EJ for her comment on that statement. And yes, Dr. Wolford, I am my brother's keeper. So
I think you're a nurse, Tanya?
Yes, ma'am.
Work here in Flint?
I work at Hurley. Yes, ma'am.
Okay, so you're experiencing this firsthand.
Yes, and it is like Dr. Hacker said, it was when I heard the recent updates from the CDC the other day, it was very, very frustrating because how can, I mean, that they were going to decrease the isolation and or quarantine time. And I really am struggling with that because I am also a part of Michigan United, and we are out in the community and we are pushing for the vaccine and encouraging people to get the vaccine and talking to people. And so for myself, I really need to believe in, you know, what I'm telling people.
Right.
So it's very, very, very frustrating right now. So.
Yeah, because you like so many others in the community, you're a trusted messenger, and I agree with you. We want to make sure if we're going to be sharing a message, we want to have confidence that that message is accurate. And sometimes during this pandemic, it's been difficult because the messages have been so unclear. So I'm going to ask Dr. Hacker while we're waiting on. Thank you, Tanya, so much.
Thank you so much.
There's if another participant would want to share, please raise your hand and we'll acknowledge you and you'll be promoted to have a comment. But I'm going to ask Dr. Hacker again, with all of these things that are being said. Dr. Hacker, what are you recommending for us here in Flint, Genesee County? Just really just straightforward. What do you want us to do?
Wear your mask, even outside in close contact. And you won't see that written down anywhere anymore. But that is what I have done my own research, you know, exactly as all the other doctors are doing. And we don't have any real reason to think it would be any different than that, you know, notorious Rose Garden situation where we know it was passed outside, and this is a much more transmissible variant. So I am having a bit of trouble. So I looked to see if MDHHS has put out the one that I was given last night that was going to be released today. And there were a couple things that I know they were going to probably change in that most recent one, but they said they were going to put out this morning. Has anyone seen it? Because I can't find that they've released another one today. And so if they haven't, I don't know what's going on with that.
I've been searching also. That consumed an hour of my morning trying to find a clear, concise, lucid statement that provides direction.
Well, they were going to change it again, even though they just changed it yesterday to say that they were going to consider, they weren't going to follow the CDC guidelines at this moment, but they were going to consider, you know, which direction they wanted to go. I mean, if you want to hear my personal thoughts on this, because I have done quite a bit of research on it, is that at the point when we really have and know that it's Omicron in the community, which we are not there yet. You know, Michigan is still not at the point where Delta is gone. We still have probably about 30% Delta cases. And that is based on a little bit of finding out what the state lab's going on, but that always lags because of the testing. And so if you push that forward a little bit with the doubling time of 2 to 3 days for Omicron, then in about a week or 10 days, my estimate is that it would be the majority of cases. And at that point, when it truly is the majority of cases, I do feel comfortable reducing the number of days of quarantine and isolation a bit, because the Omicron variant is going to has a much shorter incubation period, between 2 and 3 days. And you then would have at least a full incubation period plus at least 1 or 2 maybe standard deviations. So you're not going to have that many. However, to do it now when we really think that there's still quite a bit of Delta circulating in our communities, Delta is completely different. And I'll try and explain this where everyone would, you know, like, if you, whether or not you have the science training of it, it's still understandable. But so the incubation period is when you're exposed to when you start either having symptoms, if you're going to have symptoms, or you're positive because you actually now have the disease. And for Delta, that is 4.3 days on average. A standard deviation means, like, if 50% of the cases are within, this amount of time, how many more days would you pick up an additional, say, like about 30% to do that, and then find that you're getting all the earlier cases, the ones that converted faster, plus you're getting all of the cases, or a lot of the cases, that would take longer between exposure and the time they become symptomatic. So for that, that's called the standard deviation. So for Delta, it's actually 2.4 days on average. So if you add the 4.3, which is the average, with that 2.4, which is one standard deviation, and what that means is you're going to pick up 86%, 84% of all the people who are exposed and are going to get cases within about 7 days, which is what number a lot of people are using now. Within about 7 days, you'll get all but about 15% of the cases will have shown up as either a positive case with symptoms or without. That's something I'm a little more comfortable with. But if you go to that 5-day period right now, what you're doing is releasing people who may have been infected with Delta right at their most infectious time. And that's why I wanted to delay using that 5-day period for quarantine and isolation for another week or 10 days, because that would give a couple more times for Omicron to double in our communities and be the dominant strain. So
why
that's why
Dr. Hackert. So I think we're being encouraged to stay masked up at least for a couple more weeks without question. But when you mentioned that
and vaccinated,
yes, and tested, and we'll get to, but the idea, the way we find out what's the most prominent strain is people have to get tested, right? And then those tests, Dr. Reynolds, you mentioned earlier the genotyping. That means that they're actually looking at the samples that were received to determine whether you were positive or negative. And if you're positive, they test, and they're not testing them all, but they test some of those to see what the variant is. I see your hand, Dr. EJ. Am I right in understanding that?
Yes, I wasn't raising my hand, I'm sorry. But yes, that as Dr. Reynolds described, right? We have to have people test in order to know what variant is predominant, as Dr. Hackert alluded to. And it's important because it drives treatment, right? We know that Delta variant is still very receptive to monoclonal antibody treatment. We've had some data to suggest that Omicron variant may not be as susceptible to some of our monoclonal antibody treatments like REGEN-COV, but might be more susceptible to something like sotrovimab, right? And so it's increasingly important to understand the numbers that Dr. Hackert alluded to, so we can understand as providers, when we can use a certain treatment, when one treatment's likely to be effective in our community. So I think that's important.
So this is a real good connection between why public health is so important to our physical and clinical health. These two really need to work together. So hopefully the messages are becoming clear. Have one more question before we segue again. It's actually a comment and a question. Dr. Wolford, one of our attendants, says that because of the history of ethnic communities being used as lab rats, and this is a direct comment, how do we convince parents to get their children vaccinated? I'm at my wit's end and trying to convince parents to vaccinate their babies. At this point, I am hoping that it becomes a mandate, and Dr. Hackert, you may help in this too, a mandate in order to get us to stop being, to get this to stop and not be our community's worst enemy.
Yeah, that is such an important point, right? I mean, because there's definitely a history that we have to acknowledge. And I think that's the first step, is really acknowledging what has happened in the past. I think that most parents want what's best for their children. They love their children and they want their children to be safe. So acknowledging that is something that we need to do as well. And I think that often there's fear in giving the vaccine. And so people sort of feel like, okay, if they do something active, like gave their child the vaccine and then their fears became true, they would feel dreadful, as opposed to if they didn't do something and then the kid got COVID and something dreadful happened, they would feel like, well, it wasn't really their fault, right? So there's that kind of thought pattern about it, but they need to realize that either way, they are doing something. They are making a choice. They're either choosing to protect with a vaccine or choosing to take a chance without the vaccine. It is a choice. And so then helping them as they make that choice and helping them to get to the point where they realize that they're making the choice to help protect their child. And they have probably done this in the past with other vaccines. Most kids in the state of Michigan, we do a really good job of vaccinating our children. And in all communities, in African-American communities, do a very good job of vaccinating children. So we can look back and say, look, you gave them the Haemophilus influenza vaccine, you gave them the MMR, and it was good, it protected them, it was safe. Now there's a vaccine that, yes, in the beginning, you were a little bit concerned about whether it would be safe because not many people had it, but now we have millions of people who have it. So you have lots of data. And on the flip side, you can look at all of those who are hospitalized. If we look at children who are hospitalized, of those who could get the vaccine, 0.4% of hospitalized children were fully vaccinated. The other 99.6% were unvaccinated. If you have a child who is unvaccinated, you are allowing them to run the chance of being in that group. The numbers are really clear. You can help to try to describe those. But as I said before, we have to really listen to their fears, hopefully guide them to see how their desire to protect their child is best accomplished by giving them the vaccine.
And thank you, Dr. Wolford. And I want to ask you quickly our time. I just looked at, we're just about out of time here today. But just in the last 24 hours, I've gotten messages about children 18 months old, 4 years old, and younger who are unable to get the vaccine and are infected with COVID. They have no idea what the long-term implications of that's going to be. And so to the part of the question, Dr. Hackett, and I don't know if you can answer this, but the mandating the vaccine, I know mandates, it makes people really nervous to even use that term. But is that a way to at least eliminate? Dr. talked about the variants earlier, because it finds that it can survive better because it grows within us, and these variants occur. So is it possible that a mandate might be forthcoming?
Well, I think we've seen a few states already doing that for school-age children, but it is done at the state level. It's not done at the local level. And also, I'm hoping very much that the vaccine mandates are upheld for adults. The mandates that have been put in place, they seemingly have in every case going forward. There's another case now before the Supreme Court that's supposed to be looking at that. But I think once that gets settled, then that would open up the ability for the federal government to do a mandate on vaccines. So it is something that obviously is being considered, and it is how you can protect your children.
Thank you. And Dr. Reynolds, I'm gonna go to you on this one. We've got just a couple minutes here, but we talked about COVID and the vaccines, but there's another vaccine that we talk about that's really, really critically important, and that's the influenza vaccination. I think I mentioned last week, my grandson, actually, they took him because he was having all the symptoms, fever, tip, so forth. found out when they took his COVID test, he was negative, but he did test positive for influenza A, and they were able to treat it. So there is a guide for vaccines for both adults and children. And I'm gonna just quickly, Dr. Reynolds, we have a schedule, and I'm gonna ask if we can show the vaccine schedule while you talk a little bit about vaccines for influenza as well as COVID.
Oh, and clearly, just because we have a pandemic with COVID does not mean all the other childhood and adult infections have gone away. They are still there. And that's why it's so important for us to maintain getting those preventive vaccines, especially for childhood, and boosters, especially for adults. So do not delude yourself into thinking, well, I'm over 18, so I don't need a vaccination. Yes, you do. Okay, so if you look at that schedule, and you can find these schedules online, I recommend you go to the CDC vaccination schedule or the health department vaccination schedule, and look at these things and talk with your doctor. If you can't remember when your last vaccine happened, uh, ask your doctor if they can pull up your record. You can ask the pharmacist if they can pull up your record so that you know what you need. And for me, it's an experience. You know, I'm a senior. Some of us on this call are seniors, and we've gotten boosters that we never expected that we'd have to get again. But this is because as we learn more, we know more, and we understand the effectiveness. And for some of us, we also remember the days before vaccines. I've said this before, you know, I have seen a child who is sick, unresponsive, and had to do a spinal tap. And instead of the spinal fluid that bathes the brain coming out clear as water, it comes out looking like custard. And then we got the Haemophilus influenza vaccine, which kills the bacteria, which causes meningitis or this kind of brain infection. And I had not seen that in the last 30 years of my being in pediatrics. So, and that's the other thing of perception. You know, I not to say younger parents have not seen these things. Younger parents have not had to visit loved ones in long-term care facilities where they've been permanently disabled or long-term disabled by some of these infections. So it doesn't resonate with them when they hear we have to do something. We don't want to return to those days. And we have the tools now and the experience to at least reduce the risk of returning to those days.
Thank you so much, Dr. Reynolds. And in these last couple of minutes, we just want to remind people they can get both the COVID vaccine, they can get the influenza vaccine. They can get them at the same time, and there's been shown to be no contradiction between those two vaccines. Just want to remind us all to continue those universal precautions. Remember our P's: protect yourself, wash your hands, wear your mask, social distance, physical distance, watch that contact. We also want to let you know that you can prepare for your guests. This is something we said, let's celebrate. This is New Year's Eve. We know folks are going to be getting together tomorrow. Please maintain your conscious awareness that we're in the midst of a pandemic and we need to protect ourselves. Just a couple more minutes. I want to say the city of Flint was not able to be here with us today, but they do have some information that they wanted to share with us. And we'll pull that up for you real quickly, that they are closed. The city of Flint is closed today and tomorrow. And they will reopen again on January 3rd. There is an update in progress regarding the water, the secondary water source. And so you can go on their website and look for that. And then there is also an update on the explosion that can be found on the city's website. Mayor Sheldon Neely and the entire city of Flint staff would like to wish the residents of Flint a safe and prosperous new year. The way we're going to have a safe and prosperous new year is that we're going to prepare for what's coming. And so if you have not been tested, please do so. Now they're closed today. today is Friday. They're closed this weekend, but Monday they will be open again. Word of Life Church, Monday is Macedonia Missionary Baptist Church, but then Tuesday through Thursday of next week, all week next week, these sites will be open. You can go to the Walgreens and get tested if you need to get tested. So please make sure. I know I've gotten phone calls immediately. Where can I go? If you go on the health department's website, you will see these locations. If you don't remember what we're saying here today, you'll see these locations. We want to thank you for joining us this week. Remember, for those of you that are social workers, apply for the social work credits. They are available for you today. The community health workers, you can also get your CEUs from this session. And let me just invite you to come back and be with us next week. You can like us on YouTube, like us on Facebook. And you can subscribe to our YouTube channel. Someone asked, will this be up on YouTube? Yes, it will. Email us if you want more information at info@hfrcc.org. Call us at 810-835-2130. And we'll see you next week. So happy New Year. Enjoy a safe, happy tomorrow, New Year's Day. And we'll see you right here next week for the Flint Community Webinar on coronavirus.
And don't drink and drive.
Thank you. Ooh, I was over by a minute, but we made it. Thank you all for such a